pretty much we have the spine, and I'm going to use this anatomy model here more so than this, but we have the spine and we have the SI joint, and your lower back pain is practically just around this area. More specifically, when I was poking on you, I was poking on the L5 vertebra, the right, the left, the center, like right around this area, right around that area, and almost every time it was like more painful on the right. So if I had to guess, is it right or left? I'm gonna say right at this point in time. It's very rare that I get somebody coming into me 2 hours after an injury, but when people know it's severe or is intense, they know it's intense, and that's why you're here. So what I think you have at this point in time, and I'm going to say why at this point in time, not versus later, is that you just compress the disc. The disc is just a fluid, or I guess you could say, I guess a ring of cartilage with some fibrocartilage in there, and it allows it to absorb shock. In addition to that, it's a spacer for the nerve. So when you compress it aggressively, it can hit the nerve. That's what we see sciatica and all those other fancy terms that go down into the leg. I tested you for that, by the way. I tested you for sciatica and all these other things where we pull down on the leg, and that's why I did all the funky tests where I pulled your leg going the outside, the inside. I tested all the distributions. All of that stuff came up negative for neurologic pain. It did create a little bit of pain into the lower back. Remember that? But the reason that happened, people ask me like, well, why did if that's a sciatica test and it caused me low back pain, does that mean I have sciatica? No, it might mean other things. It might mean that just like as you lift the leg, well, imagine this being like a clock dial. So use your like kind of engineerish mind. Like this pelvis like a clock dial. You're gonna kind of rotate it this direction as the femur comes up into 90 degrees. So as this comes up in this direction, it has to do like a scooping motion, like ice cream scoop motion, right? So when it does that scooping motion, what you're doing is you're adding flexion to the lumbosacral joint right there. So you end up doing this.
Yeah.
You're doing that. So, right? And that's why I believe that caused it. Because you were actually at, like, true sciatica comes up around 20, 25 degrees. You can have some neural irritation a little further on. You were up about 70, 75 degrees, maybe 65 degrees, which is way above that area. But that's where the point where the LS joints start to open. So that's like the funny part about, not the funny part about, but that's the interesting part about it, is that anytime I did flexion, when I did stuff like with the hip and then doing this, it's all like about, like even when you do this, like maybe you can't do this right now, like I could feel that joint move, like back here. So anytime I did that type of stuff, that happened. I don't think you had, you were having like a true sciatica or compression to the nerve. There may be some moments, and I say this now because it's a little early, where if you feel numbness and tingling go on, that gets a lot of people scared. I don't think that's a problem. I just think that at this point in time, it's just something to watch out for. You want to know, is it going down the leg? Where is it going down the leg? How far down does it go? That's more my job. But like, I just need to know, is it going down, yes or no?
Yeah.
Ice is your friend at this point in time. No heat whatsoever. Unless you're showering and then you're out of the shower, that is it. If you're not going to use ice, don't use anything.
Okay.
Like, and that's what's going to happen. So when we bend forward and we touch our toes or do any lumbar or pelvic flexion, what we do is we end up bulging this backwards. That's the most common mechanism when it comes to picking up a weight, right? That's how you hurt yourself. Everything I tested you on hurts. When I put you on the ground and did the extensions, you actually felt a little bit relief of some discomfort. So what that does is that pulls this direction, and then we add the extension. It literally helps to reabsorb. And I'm not like pressing and then releasing. I'm maintaining that pressure, and I'm just doing this.
Mm-hmm.
So that's kind of how that mechanism works. It's called McKenzie extension, and that extension is going to help reabsorb that. It's not about how high you do it, it's about how often you do it. And it's about do you actually do it, and do you get relief of it. If you don't get relief, that's okay, by the way. It really is, believe it or not, because sometimes it's like about repetitions, right? Just like anything else, if you draw a CAD design, it's like you suck at it the first 5 times and then like start to understand certain, you know, parameters and things like that and how the system actually works. It's just more about repetitions over time. That's actually the biggest thing for you. If you ask me personally, if you have any increase in pain, just stop. You know, that doesn't mean you did it wrong or anything like that. Maybe you went too high, maybe your technique was off, maybe you were rushing, maybe a dog was licking your ear, like, who knows, like, but at the end of the day, like, it should relieve some pain. So when you go through this stuff and you do this stuff at home, this is going to be like the bread and butter for you. This is like the only freaking thing you need to do. That's it. It's really, really, really helpful. I can talk to you a little bit more about discs and stuff like that, and what we're gonna